This is a production from the Center to Accelerate Population Research in Alzheimer's. This work was supported by the National Institute on Aging of the National Institutes of Health and by the Institute for Healthcare Policy and Innovation at the University of Michigan. The content is solely the responsibility of the presenter and does not necessarily represent the official views of the National Institutes of Health or the University of Michigan.
Thanks for joining me for a brief introduction to the National Health and Aging Trends Study, or NHATS. So here's our brief outline. We'll go through what NHATS is. We'll go through how you can identify dementia in the survey, a couple of example papers, and then I'll point you in the direction to find this data if you want to work with it yourself. So the National Health and Aging Trends Study is funded by the National Institute on Aging. It's a nationally representative sample of Medicare beneficiaries who were 65 years of age and older. From the study information, here's a quote. It's an annual in-person interview that collects detailed information on the disablement process and its consequences. So they really want to understand how older adults are aging and how their function changes over time. The survey started in 2011, and it's been collected every year since then. So what exactly is in it? It's a lot of information. Here are some highlights, and we'll walk through these just to give you a little sample of what's in there. So a lot of focus on various measures of physical, cognitive, and functional capacity. So that includes things like mobility or getting around inside or outside of one's home, self-care activities like eating, dressing or bathing, household activities like doing laundry or shopping, medical care activities like handling prescription medications or interacting with physicians. In addition to questions about those activities, they also ask about assistance completing those activities. So this could be assistance from people who say, help you get dressed. It could be assistance from devices like a walker or a wheelchair to aid in mobility, or it could be home modifications like a grab bar in your shower that helps during bathing. There's a section on the technological environment, so questions about access to and use of cell phone or computers. You could imagine in this pandemic era that those items are actually of great interest for how older adults are functioning. And then there's also questions about using tech to do tasks like shopping, bill paying, or contacting medical providers. There's a series of questions that get at living arrangements, so both the type of residence that the respondent lives in, features of the home environment, including things that can help with function like those shower grab bars, additional information about the household. So is the respondent married or living with a partner? Are there other people who live in the household? There are additional questions about sort of the environment, stairs needed to get to the home, cracked sidewalks outside, to really give you a sense for the type of environment that the respondents live in. There's a whole series of questions related to economic status that sort of cover the bases that you might expect would be covered. And finally, for respondents who pass away between waves, there is a last month of life survey where, say it's the 2017 wave, the respondent has died between 2016 and 2017. So the survey actually interviews a caregiver or a surrogate and asks questions focused on the last month of the respondent's life, including questions about symptom control in that last month of life, so pain or breathing troubles. They ask the surrogate questions about their input into the respondent's care during that last month of life and whether the respondent's needs were being met. And then they also ask about interactions with other providers during that end of life period. So the kind of power and the utility of NHATS is enhanced by some of the add-ons or the data linkages that you can do. One of them is Medicare data. So as part of consenting to participate in NHATS, all respondents agree to the linkage of their data with Medicare claims data. Of course, getting that data, there's a separate request process, but you could imagine that there's some really important analyses that you can do by linking the survey data with their Medicare claims data. In addition, there's a companion survey called the National Study of Caregiving. And so you might recall a couple slides back, we talked about either people or devices that help the respondents with their function. So a respondent might say they need help managing their medications. The survey asks, who helps you with that? And so what they do is for respondents who report having people in their lives who help them complete tasks, there's actually a separate survey of those people, of those caregivers, and those caregivers end up in NSOC. So there can be up to 5 caregivers who are identified, who that then NSOC reaches out to contact to. So now you can link both the NHATS respondent as well as their caregivers. This could be a spousal caregiver, it could be a child, it could be a non-relative. They're eligible simply if the NHATS respondent said, yes, this person helps me on a task, then they can be included in NSOC. So now how is dementia identified if that's what you're interested in exploring? So there are 3 data elements in the NHATS survey that are used to come up with a classification of probable dementia. So the first is there are 3 different cognitive instruments. So memory, orientation, meaning like date or time, and then name of the president and the vice president. There's also either self or proxy report of a doctor's diagnosis of dementia. And then finally, there's an instrument called the AD8, which is 8 questions like these. Does the respondent have difficulty remembering the month or the year? Do you find that they repeat questions, stories, or statements? So a total of 8 questions like those. And basically across these 3 data elements, they come up with a classification of probable, possible, or not present for dementia status. There's the NHATS has developed a technical paper explaining where that measure came from and how it was validated. And they also actually provide STATA code so that you can just press run and it will generate this classification status and you don't have to manually classify these folks yourselves. So now we'll just go through a couple examples of the types of work that people have done with this survey. So this first example is just with the NHATS survey alone. And so a lot of the papers that have come out with NHATS have been really powerful descriptive work. This is one example published within the past year in JAMA Internal Medicine, where they simply looked at unmet need for equipment to help with bathing and toileting. So essentially, they looked at NHATS responses, both provided by the respondent about sort of things that happened over the past year. So that would be reporting 2 or more falls in the past 12 months. They looked at functional status, so item reporting showering or bathing with a lot of difficulty. And then they looked at some performance measures that are included in NHATS. And so that's this unable to semi-tandem stand. So they looked at these items and came up with a way to identify respondents who needed help, who needed bathing equipment. And then similarly, they looked at responses to identify respondents who needed or would benefit from toileting equipment. And then you can see they actually looked at who reported having equipment. Specifically, they looked at grab bars and toilet seating equipment. And they can say, you know, nationally, significant proportion of older adults who would benefit from help with bathing and toileting don't have the equipment that would help them that they need. Another example of a paper, this one uses one of those LinkedIn data sources, specifically the caregiving survey, and they were comparing the caregiving burden or hours required for dementia, respondents with probable dementia compared to NHATS respondents without dementia. And they can look at the level of assistance. So people who need help with 3 or more care activities. Among those without dementia, it was only about 14% of respondents compared to nearly 40% of respondents with dementia needed a significant amount of help. And then they could also look at the number of hours provided per caregiver. And so, for example, on the bottom right, you can see that among NHATS respondents without dementia, about 73 hours of caregiving help were provided compared to over 100 by caregivers of people who had dementia. And then finally, here's an example of the NHATS survey linked with Medicare data where they were looking at hospitalization risk as the outcome. And they wanted to see if there were specific caregiver characteristics that were associated with either higher risk or lower risk of hospitalization. So this is just a very high level overview of this incredibly rich data source. So I would point you towards actually the NHATS study website. They've had a significant redesign within the past year. They have a series of video tutorials on how to use the survey. And this is where you can find the data for the survey. In addition, you can see in the top right that there's a publications link where you can have a look yourself and see the various types of analyses that people have done with this data. And you could also see maybe where people haven't published much to get a sense for where might be a useful place to focus your efforts. That's all. Thank you very much.
Make sure to check out our website at capra.med.umich.edu. There you'll find additional information on how to get involved with CAPRA, information on pilot funding opportunities and past awardees, and resources for conducting dementia-related research, including data, programming script, and Finder files to identify cases in publicly available datasets. Also, make sure to check out our podcast, Mining Memory. In this podcast, we speak with leaders in dementia research and discuss a variety of topics related to dementia. Mining Memory is a Michigan medicine podcast, and episodes are available wherever you get your podcasts.